Hi, my name is Ellen Flynn. Today I'll speak about my master's dissertation project, which was supervised by Dr. Emily Newman at the University of Edinburgh. Before and after weight loss transformation photos have emerged as a popular trend on Instagram. As of October 2021, hashtag before and after weight loss captures over 1 million posts. Hashtag weight loss transformation captures over 12 million. No published studies to date have looked specifically at the impact of viewing before and after images. So what do? We recruited 404 English-speaking female participants aged 18 to 30 to partake in a voluntary online study. Using a 3x2 mixed design, participants were randomly allocated to one of three image conditions with pre and post testing. In group one, participants viewed side-by-side before and after images with the faces blurred. In group two, we took the same before and after images. However, this time we split the image in half, so they were viewed not as a side-by-side and were in a randomized order. Basically, this group saw the same bodies, but not in the context of a before and after. Group three viewed travel as a control. Each group viewed for a total exposure time of 3 minutes, which included attention checks to ensure participants were attending to the images. As before and after images purport to be fitspirational, we also asked participants pre and post to report how inspired they felt to eat healthily and improve their fitness. So what did we find? In post-testing, the group which viewed the before and afters showed a significant increase in negative mood and state self-objectification. There was a decrease in state body satisfaction that was not statistically significant. In group two, which viewed the before and afters separately, there was also a significant increase in state self-objectification. However, in direct contrast, there was a significant increase in state body satisfaction in this group. Viewing before and after images did not change participants' self-reported inspiration to eat healthily or improve fitness. This study is the first to investigate specifically the effects of viewing before and after images. The findings are particularly noteworthy considering the brief 3-minute exposure time. Young women in this age bracket are the largest demographic group of Instagram users globally, and the modal daily use of social media platforms reported by this sample was over 3 hours. 93% reported being active on Instagram. Future research could explore if these findings generalize to other populations and also explore the implications of these findings from a qualitative perspective. Thanks for listening and enjoy the conference.
Frontline health and social care workers have provided an essential service throughout the COVID-19 pandemic. And while rapid research has found that health and social care workers are at increased risk of developing stress-related conditions associated with the COVID-19 pandemic, little is known about what may help protect their mental well-being. This study tested two hypotheses, the first being that increased scores and COVID-19 related risk factors will predict lower mental well-being, and the second hypothesis, protective factors will mediate the relationship between COVID-19 related risk factors and mental well-being. This study consisted of a cross-sectional study conducted online via Qualtrics, exploring the impact of COVID-19 on the mental well-being of health and social care workers in Scotland. 1,364 health and social care workers responded to the survey, which included psychometrically valid measures of COVID-19 related risk factors. These factors were coronavirus risk perception, COVID-19 stress measure, COVID-19 burnout scale, and the post-traumatic stress disorder checklist civilian version. And protective factors explored and psychometric measures used were the brief resilience coping scale, the team resilience scale, and general help-seeking questionnaire. This was associated with their outcomes and mental well-being as measured using the Warwick and Edinburgh Mental Wellbeing Scale. The data was analysed using multiple regression and parallel mediation analysis. Open-ended questions within the survey, exploring mental health workers' views on the risks and protective factors for their mental well-being, were analysed using qualitative content analysis. Our results showed that COVID-19 stress was found to be a significant independent predictor of well-being, where well-being declines as COVID-19 stressors increases. Both adaptive coping and team resilience significantly predicted better well-being and reduced burnout scores. Content analysis of open text responses found both risk and protective factors for health and social care workers' mental well-being. The findings emphasised the importance of adaptive coping, team-based resilience, and alleviating negative impacts of COVID-19 stressors on health and social care workers' mental well-being and in the prevention of burnout. Work-based supports and access to psychological input for those who need it was highlighted. Building a resilient workforce moving forward requires attention to staff mental well-being and ensuring sufficient support systems are robust and accessible. Efforts have been made to adapt the delivery of mental health care and support services to meet the demands of the COVID-19 pandemic. Here we detail the perspectives and experiences of NHS mental health workers in relation to what they found helpful when adapting mental health services during the pandemic and responding to its demands. We conducted individual interviews with 30 NHS mental health workers during the third COVID-19 lockdown period. We conducted in-depth semi-structured interviews which were audio recorded, online, transcribed and managed using the programme NVivo. Qualitative data was analysed using an inductive thematic approach. 3 key themes emerged from our analysis which emphasised the importance of self-care and peer support, so that being staff checking in with each other, team cohesion and collaboration in building resilient teams, and the importance of visible and supportive management and leadership in establishing new ways of working. These themes highlighted how staff would feel supported in preparing for future pandemics and other emergency situations. Our findings emphasise the importance of individual, team, and systems-based supports in helping mental health workers maintain their own mental well-being whilst adapting and responding to the challenges and providing mental health care and support during a pandemic. Guidance and direction from management with adaptive and compassionate leadership in providing sustained, efficient and equitable delivery of mental health care is essential. Our findings support future policy research and mental health practice developments through sharing important salutogenic lessons learned and transferable insights.
Hello, my name is Iona Gray and I'm going to be talking about the impact of Instagram use on body satisfaction and disordered eating in young people. Instagram is a social media platform that focuses on aesthetically pleasing images through posting photos that receive social feedback through likes and comments. However, this has contributed to Instagram focusing on users' appearance, with the platform indicated to detrimentally impact body satisfaction and disordered eating. With over 1 billion monthly users and 60% of young people accessing Instagram daily, this poses risks to young people. Previous research investigated the impact of time spent on Instagram, leaving a gap to address the impact of specific Instagram content and moderating factors influencing Instagram users' vulnerability to disordered eating. In line with this, the current study will investigate the relationship between Instagram use, disordered eating, orthorexia, body satisfaction, and socio-cultural attitudes towards appearance, before evaluating body satisfaction and engaging in weight loss, fitness, and fitspiration content, and moderating the relationship between Instagram time and disordered eating. Self-report measures were collated into an online survey and distributed via social media completed by young adults. For our data analysis, we initially conducted correlations as illustrated in Table 1, and as you can see, we found that time spent on Instagram was associated with higher disordered eating. This is highlighted within the red circle. Moving down to Table 2, regression analysis demonstrated that time spent on Instagram accounted for 3.7% of disordered eating, as seen in Model 1, while Model 2 illustrates that engaging in fitspiration, fitness, and weight loss content accounted for 18.7% of variance, with Model 3 demonstrating that body satisfaction accounted for 47.7% of variance, with body satisfaction and engaging in weight loss content significantly predicting disordered eating in the final model. Moderation analysis indicated that body satisfaction significantly moderated the relationship between time spent on Instagram and disordered eating, so a simple slopes analysis was conducted, shown in Figure 1. You can see the clear differences between those with high, medium, and low body satisfaction. What's also interesting here is that those with low body satisfaction and spent more time on Instagram are more likely to report disordered eating, while in contrast, those with high body satisfaction reported low disordered eating, regardless of the amount of time spent on Instagram. So what do these results mean? Well, these findings suggest that greater time spent on Instagram is associated with increased disordered eating, with engaging in weight loss and fitness content posing risks for disordered eating. It's also indicated that users with low body satisfaction are the most vulnerable to the detrimental impacts of Instagram. This has implications for users, and in line with this, future research should analyse the long-term impact of Instagram use to establish the causality of temporal relationships. Thank you for listening and enjoy the rest of the presentations.
Hi there, my name is Karina Stewart and I'm a trainee clinical psychologist at the University of Glasgow. I'm presenting a service-based evaluation of an online CBT psychoeducation programme, which was developed and delivered by the Northwest Primary Care team in Greater Glasgow and Clyde. So the team had been providing a group CBT programme for years within the service, but following the pandemic, all face-to-face appointments were cancelled. So the team developed an online version of the programme to continue to meet service user need. There's good evidence that group and online interventions are effective and efficient ways of supporting people with mild to moderate mental health difficulties. So our audit evaluated the acceptability of this online version of the programme, and we were specifically interested in uptake and completion rates, and also barriers and facilitators to completing the programme in an online format. So the programme itself involved 7 weekly pre-recorded presentations that covered a range of CBT tools, and people were given handouts and 8 weekly telephone check-ins with a clinician. So data on uptake, dropout and completion was obtained from EMIS records, and we also developed an online feedback survey where people could anonymously provide feedback regardless of whether they completed the programme or not. So of the 17 people offered the programme, 16 accepted, and 14 of those went on to complete the programme. We received feedback on this survey from 8 of those individuals, and all of them rated their experience of the programme as being good or excellent. They also reported increased knowledge and confidence in managing their difficulties after completing the programme. We conducted thematic analysis of open-ended responses on that survey, and we identified a number of barriers and facilitators to engaging with the online programme. And what we found really highlighted the importance of people's personal circumstances and their preferences when it comes to engaging and benefiting from this intervention. So one thing that really stood out was that the flexibility of doing it online and in your own time could really facilitate engagement. And the telephone check-in with the clinician was also a huge source of support for some of the people who took part. So overall, the findings regarding completion rates and feedback indicated that the online programme was generally acceptable, and those who provided feedback, their satisfaction ratings were fairly high. Now, we know it was a small sample size and there's potential bias with maybe those who weren't very satisfied or didn't complete the programme, maybe not responding to the survey. So it'll be important to keep evaluating it in future. And if the online programme is incorporated in the service, it might be that those that meet criteria for CBT psychoeducation could have a choice between doing it online or doing it in the group format. Thank you.
Rapid research has discovered that the psychosocial stresses induced by the COVID-19 pandemic, such as the risk of infection and government-led restrictions, have adversely affected mental health. Those working in frontline healthcare positions are at particular risk of acquired stress-related disorders such as anxiety, depression and PTSD, due partly to heightened service demands. Yet, little clinical research exists regarding the psychological impact of mental health workers as they continue to support the needs of others at this time. Therefore, this project chose to explore how COVID-19 has impacted their personal and occupational lives within a Scottish context. 11 mental health workers were recruited through channels within local NHS health boards in the west of Scotland. They each took part in a semi-structured interview exploring the topics of their COVID-19 related concerns, working adaptations and supports, and psychological well-being. The interviews took place over Zoom and were audio recorded, transcribed verbatim and analysed using an inductive thematic approach. Analysis revealed 3 master themes important to participants' lived experiences during the current pandemic. Firstly, participants felt their services being overlooked as essential by the government. This lack of recognition and guidelines led to uncertainty surrounding how they should operate moving forward, which caused anxiety and frustration. Mental health workers also stated that they were running at under capacity as they did not receive appropriate funding to match their working demands. Secondly, participants reported struggling when working virtually from home. Assessing risk was found to be particularly difficult online as they did not know if their patients were in safe environments to talk and could not gauge the whole picture of their health without using non-verbal cues. On top of this, participants found it hard to dissociate their work and home lives, reporting that difficult conversations would become associated with the spaces they used to relax and that it was common to work longer hours. These factors in combination led to participants feeling exhausted, overcautious and fearful that they were not providing appropriate care. Finally, various barriers presented to participants seeking formal supports for their psychological well-being. These included a lack of perceived need, as they did not believe their worries were at a clinical level, their ability to utilise their own therapeutic skills in self-care, particularly acceptance to cope with their limited working capacities, and thirdly, feeling protected by support within their working teams, who were seen to be more empathetic and receptive. The findings imply that mental health workers' well-being suffers most when their working capabilities are reduced. Appropriate government funding and recognition should be given to mental health services as an integral component of pandemic response and recovery. This would improve communications and alleviate the felt pressures of working at under capacity. Findings also emphasise the importance of self-care and team-based supports for protecting mental health workers' resilience. Further research is needed into effective components of mindfulness and acceptance-based interventions and the incorporation of self-care into educational training programs to promote this within organisations. The psychological well-being of mental health workers should not be overlooked as they are not immune to the psychological stresses we are all currently facing. Thank you for listening to this presentation. If you have any further questions about the study, please feel free to contact either myself or my project supervisor. Our details are at the bottom of the poster.
Hi, I'm Katharina Dixon-Ward and I'm here to talk about a project I conducted at the University of Edinburgh in 2020, which was supervised by Dr. Stella Chan. This was called Faking It, Exploring Adolescent Perceptions of Depression, Inauthenticity and Attention Seeking, and it's forthcoming in the British Journal of Clinical Psychology. So while adolescent depression stigma has been a focus of an extensive body of research, adolescent attitudes towards peers who are perceived to be attention-seeking, performing, or faking depression represent a significant research gap. Attitudes towards peers who are not perceived to be legitimately depressed, whose experience is invalidated, or whose depression authenticity is held in question, have also been overlooked by current school-based depression awareness programs and stigma campaigns. So we wanted to investigate how perceptions of depression inauthenticity are framed in adolescent Reddit communities. This was an observational study which used internet-mediated qualitative methodology. Forum posts from April 2019 to January 2020 were analysed on 3 adolescent-based subreddits. Posts were extracted using the Baumgardner Reddit corpus, and identifiable information was removed to protect anonymity. Inductive thematic analysis identified two overarching themes: public stigma and self-stigma associated with depression inauthenticity. Public stigma consisted of 5 subthemes. Firstly, dichotomy between perceived real and fake depression. Secondly, aggression towards perceived fakers, stereotypes, attention, and diagnosis. Self-stigma consisted of 2 subthemes. Firstly, self-doubt, and secondly, validation and invalidation. So what are the key implications here? Adolescents framed a dichotomy between so-called real and fake depression. There is widespread stigma concerning perceived inauthenticity related to depression in these adolescent online communities, with vitriol targeted at peers perceived to be so-called fake depressed. Perceptions of depression inauthenticity were confused and inconsistent, and public and self-stigma towards depression inauthenticity enforced barriers to help seeking. While future research should investigate to what extent these observations based on online forums mimic stigma in real-life settings, our findings have highlighted the needs for fake depression stigma to be addressed by adolescent depression literacy and stigma interventions. Recent movements towards reconceptualizing depression as a dimensional construct may help to challenge these stigmatizing views of a dichotomy between perceived real and fake depression. Thank you very much, and look out for the study in the BJCP.
My name is Michelle Sater. I'm currently a neuroscience PhD student at the University of Aberdeen with a focus on emotion and hunger awareness. Today, I'm going to be discussing my work on the identification of neurocorrelates associated with anorexia nervosa, or AN. AN is a severe feeding and eating disorder characterized by pathological dietary restriction. Compared to other EDs, this disorder displays higher relapse, lower remission rates, and especially lower pre-post recovery changes and emotional regulation, indicating that current protocols are insufficient, require further research, and need amending. Neuroimaging research, particularly the use of voxel-based morphometry, would be an effective means to conduct meta-analytic research on the structural anatomy associated with anorexia. In light of a growing body of neuroimaging research dedicated towards the disorder, we aim to conduct a quantitative meta-analysis using VBM to provide an updated review of neurocorrelates. Literature for our meta-analysis was selected using Scopus, PubMed, and Web of Science. Exclusion criteria was as follows: publications older than 20 years, animal studies, publications lacking case-controlled environments, meta-analyses, reviews, or non-structural imaging studies, and no voxel-based morphometry or coordinate results. Due to literature availability, we also included studies incorporating a small proportion of patients with recovered anorexia that could not be removed. MNI coordinates from publications were collected and input into ginger ale, while clusters were visualized on Mango. For this study, 24 papers were identified with a total sample size of 1,100. Analysis of all collated data delineated volumetric increase and decrease. Regions with increased volume in anorexia relative to controls included the bilateral medial temporal lobe, left orbitofrontal cortex, and left uncus. Regions exhibiting volumetric reduction included the bilateral cingulate and right lateral prefrontal cortex. Removal of child data revealed volumetric differences pertinent to age. In adult-only data, the right paracentral lobule, left anterior cingulate, and right orbitofrontal cortex were significantly increased in those with adult AN. To date, this is the first meta-analytic investigation reporting volumetric increase associated with anorexia. Meta-analytic findings from literature over the past 20 years demonstrate significantly altered neuroanatomy in those with anorexia relative to healthy individuals. Clusters of increased volume occurred in regions attributed to executive function, decision-making, and conflict monitoring. Adult-only studies also note a significant effect within the ACC and surrounding white matter known as the GENU, which may also reflect impaired conflict monitoring, flexibility, reward-based learning, and emotional processing. Findings also reflect neurobiological theories driving pathology, such as negative anticipated emotional learning, behavioral inhibition, or impaired function and recall of autobiographical memories. This study provides an updated review of neuroanatomical correlates of AN, and implicated brain regions may serve as effective benchmarks for its detection, diagnosis, and treatment. Thank you. Hello, my name is Michelle Sater. I'm currently a neuroscience PhD student at the University of Aberdeen with a focus on emotion and hunger awareness. Today, I'll be highlighting the cerebellum as a multimodal region of the brain implicated in appetite. Appetite is a complex and multifaceted nature, and problems with eating arise from a variety of genetic, cognitive, and physiological factors. For instance, obesity serves as a major public health concern, but on the other end of the BMI measure, we have individuals with anorexia. These two conditions may not technically be on opposing ends of a singular spectrum, but there are multiple factors linking both. The cerebellum is a perfect candidate for evaluation, as traditional roles in motor coordination have been expanded to include roles in emotional regulation and appetite. While this region remains understated, an abundance of studies have pointed towards unusual structure of the cerebellum in both conditions. In view of the evidence, we aim to conduct a quantitative meta-analysis to review cerebellar structure in both populations relative to controls. Literature for analysis was collected using Scopus, PubMed, and Web of Science with exclusion criteria as follows: publications older than 10 years, animal studies, publications not reporting case control studies, inclusions of clinical groups or correlations unrelated to our study scope, publications with no VBM or no TALARAC and MNI coordinates. While conducting our search, we also identified publications evaluating correlations between BMI and volume in non-clinical subjects, which fell in line with our remaining inclusion criteria. As such, we included a third normative subgroup for our cerebellar analysis. Coordinates were collected and input into ginger ale, while clusters were visualized on Mango. For analysis, we aggregated 6 and 9 case control VBM studies for OB and AN respectively. With the inclusion of our third subgroup, our total sample size increased to about 5,000 subjects. Meta-analytic findings in both AN and OB indicate a consistent decrease in cerebellar volume. In OB, volumetric reduction was located in the right hemisphere with no bilateral effect, specifically affecting lobule 6 and CRUISE-1. In those with AN, cerebellar reduction was bilateral with a stronger effect in the left hemisphere, affecting CRUISE-1, left lobule 6, and the bilateral dentate. For both case control analyses, there were no clusters indicating increased volume. The normative analysis generated 2 clusters of reduction correlating with increased BMI. Compiling data across extremes of the BMI measure identifies significant differential reduction of the cerebellum on both extremes of the BMI spectrum. CRUISE-1, affected in OB, falls within the executive control network and plays integral roles in executive function and working memory. Lower volume in this region may reflect pathology and contribute to lower executive function with adverse effects on appetite. Lobule 6 was most affected in AN, with this region highly being associated with the salience network. Findings in typical populations confirm that the cerebellum is associated with normal variation of appetite and exhibits a negative correlation between volume and BMI. Altogether, the results of our AL analysis support the concept that the cerebellum is highly associated with dysregulated appetite, eating disorders, and body weight in both pathological and non-pathological states. Thank you.